As we age, our bodies go through changes, and losing balance is one common issue. Many people don't realize balance problems can be caused by medications. Some common medicines can actually increase the risk of falling. In today's video, we'll discuss 10 medicines that can cause balance problems, including one very common medication at number 6. How many people unknowingly put themselves at risk because of their medications? The answer might surprise you. Do you or someone you know struggle with balance? Leave a comment below so we can connect. Now, let's explore the 10 medicines most likely to cause balance issues. Number 1. Blood pressure medicines. This is one of the biggest groups. Almost any medicine that lowers your blood pressure can cause dizziness. When your blood pressure drops too low, especially when you stand up quickly, not enough blood gets to your brain. This makes you feel lightheaded or dizzy. Common drugs like diuretics, water pills, ACE inhibitors, and beta blockers can cause this. Many people take these medicines every day, and while the benefits are important, the risks are still there. If you take blood pressure medicine and feel dizzy, especially when standing, talk to your doctor. They may need to change your dose or switch to a different medicine. Number 2. Antidepressants. Depression can cause balance problems by itself, but some antidepressants can make it worse. Drugs called SSRIs like Prozac, Zoloft, and Paxil are used to treat depression, but they can also affect your balance by changing how your brain handles sensory information. Some people describe it as feeling like they're walking on a boat. These medicines can help a lot of people with depression, but if you start feeling off balance, talk to your doctor. Number 3. Anti-anxiety medicines. Medicines like Xanax and Ativan, often given for anxiety, work by calming the central nervous system. While this helps manage anxiety, it can also affect your coordination and balance. This is especially dangerous for older adults. Studies show that older people taking anti-anxiety drugs are much more likely to fall and get hurt. The risk is highest when you first start the medicine or increase the dose. If your doctor gives you one of these medicines, be extra careful in the first few weeks. Number 4. Sleep aids. Both prescription sleep medicines and over-the-counter sleep aids can affect your balance. These drugs work like anti-anxiety medicines by slowing down the central nervous system. The problem is that they can cause grogginess and poor coordination, even after you wake up. Some sleep medicines come with warnings about being impaired the next day. If you're having trouble sleeping, it's good to try things like better sleep habits or relaxation techniques before using medicines. Number 5. Antihistamines. Here's one that might surprise you. Antihistamines, which are commonly used for allergies, can affect your balance. Older antihistamines like Benadryl are more likely to cause drowsiness and dizziness. Even newer ones like Claritin and Zyrtec can cause balance problems for some people. If you find yourself feeling unsteady after using antihistamines regularly, talk to your doctor about which one might be best for you. Number 6. Pain medicines. Both over-the-counter and prescription pain medicines can cause dizziness and affect coordination. Opioids in particular are risky because they affect the brain and can make you feel unsteady and affect your judgment. Even common pain relievers like ibuprofen can cause dizziness for some people, although it doesn't happen as often. If you're taking pain medicine and notice balance issues, talk to your doctor about safer options. Number 7. Diabetes medicines. People with diabetes are already more likely to have balance problems due to nerve damage. But some diabetes medicines, especially insulin, can lower blood sugar too much, which causes dizziness and makes it hard to keep your balance. It's important to check your blood sugar regularly if you're taking these medicines and know the signs of low blood sugar. Number 8. Heart medicines. Certain heart medicines like digoxin, used for heart failure and irregular heartbeats, can cause dizziness and vision problems. Antiarrhythmic drugs, which treat irregular heartbeats, can also affect balance because they sometimes interfere with the inner ear, which helps control balance. Number 9. Parkinson's medicines. Parkinson's disease itself causes balance problems, but the medicines used to treat it can sometimes make things worse. Drugs like levodopa, which increase dopamine in the brain, can cause your blood pressure to drop when you stand up, making you feel dizzy. Number 10. Antibiotics. Most people don't think of antibiotics causing balance problems, but certain types, especially a group called aminoglycosides, can damage the inner ear. This can lead to permanent balance problems and even hearing loss. These antibiotics are usually only given for serious infections, but it's important to know about this possible side effect. Now, you might be thinking, should I stop taking my medicines? Definitely not. For most people, the benefits of these medicines are more important than the risks. The goal here is to help you be aware of the possible side effects so you can talk to your doctor if you feel dizzy or have balance problems. Your doctor may change your dose, switch your medicine, or offer tips to handle the side effects. You can lower your risk of falling by exercising regularly, eating a balanced diet, and making your home safer by removing tripping hazards and adding handrails. Stay hydrated because dehydration can cause dizziness, and be careful with alcohol, as it can worsen balance issues when mixed with medications. It's also important to have your doctor review your medications regularly, especially as you get older. Our bodies change, and we can become more sensitive to side effects. Regular checkups can help catch any problems early. We often take medicines without thinking about side effects. Don't hesitate to ask your doctor questions like, "Why am I taking this?" Or, "Are there safer options?" Understanding your medications can help you manage your health better. We want to hear from you. Are you taking any of these medications? Do you experience balance problems? Share your experiences in the comments. If you found this video helpful, type yes in the comments and don't forget to like, subscribe, and turn on notifications. Share this with your friends and family to help them stay informed about medications that can cause balance issues. Thanks for watching and stay healthy.